following show contains adult content. It's not our intent to offend anyone, but we want to inform you that if you are a child under the age of 18 or get offended easily, this next show may not be for you. The content, opinions, and subject matter of these shows are solely the choice of your show hosts and their guests, and not those of the Entertainment Network or any affiliated stations. Any comments or inquiries should be directed to those show hosts. Thank you for listening.
Hey everyone, and welcome to 50 Shades of Bullshit. I'm your host, Christine Lalonde, and this is the podcast where we uncover the truth about online dating. Now let's begin. Hey everyone, I'm Christine.
I'm Jada.
And this is 50 Shades of Bullshit. And we're back again. Yeah, another week. Another week. Hi everyone. Thanks for joining us. How's your week going, Jada?
I'm just kidding.
I love it. I asked you and you're like, crickets.
Yeah. No, it's actually going well. You know what? Here's the thing. Do you feel, am I the only person that feels this year is going so insanely fast?
Tremendously fast? Like,
it's wild. I'm like, it's already Thursday. We're a couple weeks from August. It's already back to school time. So what is happening?
I don't know, but it's picking up speed and it's hauling ass, and I don't understand it. I mean, I thought time was still the same regardless of how old you were, but maybe it's because we're older, and when we're kids, it just seemed to drag on because we're not as aware of everything that's going on or what we're doing. But time is hauling ass, and I don't like it.
Time is moving and shaking. I had someone tell me there's like 24 more Fridays until Christmas. I'm like, what? Huh?
Okay, I don't like that because the holidays kind of freak me out. So
yeah, well, they are right around the corner, honey. How are you? How was your week?
It was good. I watched it's good. Nothing normal. I mean, everything's normal, nothing crazy. I'm getting through the week. It's Thursday happened really fast, and you know, I'm preparing for my documentary, Darling of the Derby, and I'm, working with the people who are going to be interviewing and doing the reenactments, and it's just been a lot of fun. I am seconds away from having the sizzle reel for a Nolan Miller project. Is almost done, so I'm getting there.
Nice.
Getting there.
Nice. Congrats.
Thank you. I was gonna say I watched the new Bachelorette last night. I think it's like 2 episodes in.
I haven't even watched it. Forgot it was even on.
Yeah, thank you, Country Corners Gazette. Yeah, things are going good. You just take one day at a time, and I do positive manifesting, and I do my meditations and keep my head in the game. So
yes, I do want to say one thing. Just shout out. Just kidding. To Diana, who did the readings last week.
Yes, you have not told me how your thing went.
I will have to tell you everything. It's so much. But for those listening, I had a reading with her on Sunday, and when I tell you, it was absolutely incredible. So for those people that haven't reached out to her, I think you should do it. I did mine for an hour, and I was like blown away. She even sent like the recap, like she sent the replay of it, and so I've re-listened to it, and I'm like, oh my gosh, she was just spot on with so many things. So if you're listening, thank you again, Diana. It was amazing.
Oh my God, I have to set that appointment up for myself. I just haven't had time.
Yeah. I told you I ordered the Oracle deck too. It should be here actually. I haven't checked my mail, but we'll have to go through that.
Yeah, I want to get one too, because my Oracle deck that I have, I've had it for, oh my gosh, maybe 30 years. I don't know. I've had it a long time. Yeah. Yeah. Hi,
Yeah.
Charles. Thanks for coming back.
Charles.
So I'm really excited about this episode.
Yeah.
I'm glad you're all joining us again because we have got Sarah. Today's episode is called Sex and Intimacy in Midlife. Are we midlife? I think we're midlife now. And what's estrogen got to do with it? I know we're talking a lot about this lately, but we've been asked a lot about these kind of subjects, so we're back talking about it again this week. Sarah Shealy is a certified nurse midwife and professor of nursing and a mother of adult daughters. As a woman's health expert, Sarah has helped thousands of families through birth, postpartum, severe personal health challenges during perimenopause, oh my God, maybe I should try to learn to read again. I'm having a moment. Because of severe personal health challenges during perimenopause, it prompted Sarah to dive deep into the psychology and treatment options for the menopause transition. Her health and learning journey resulted in earning certifications by Menopause Society as a Menopause Society certified practitioner. Try saying that 10 times. I dare you. She went to Yale School of Nursing. Sarah is dedicated to staying up to date and connected with other experts in the field, and ensuring clients receive cutting edge care. Feeling good through menopause transition requires attention to hormones, nutrition, movement, mindset, sexuality. That's where we're going, and rest. So let's just bring Sarah on. She has a continual bio that goes on because she is amazing.
Hi, everybody. Thank you, Christine and Jada, for inviting me to come on here. When I saw the name of your podcast, I was immediately like, what is this about? And then when I saw that it was originally about online dating, I was totally fascinated because that's how I found the love of my life a long time ago, at the beginning of internet dating. And I'm a big believer in all of it. So I'm really, really happy to get a chance to be here with you guys and talk about all the things about sex.
I love it. Well, we love talking about sex on this show.
Yes, we do.
I love it.
And off the show.
Well, I think we love talking about sex. And in reality, we often don't get enough time with clinicians. Like, clinicians generally are not very comfortable talking about sex. And so it turns out that women rarely talk about sex in their, health visits, because also a lot of clinicians are not comfortable talking about sex. So I thought, let's just talk about sex for an hour with you guys.
What's funny is that when I go to talk, to my gynecologist appointments or talk to my doctors, they don't feel comfortable about talking about my sexuality. I'm really open about how I feel and what I, try and experiment with and do. And they don't really want to talk about that. So I think also that's why men don't really go when they're having erectile dysfunction issues. I don't think that they want to even talk about it because I don't think their doctors are making it comfortable for them, especially if you have a female doctor. And I've heard a lot of men say, I had my appointment, this female doctor, she was so hot. She grabbed my balls, she squeezed them, whatever. And I'm like, did you talk to her about your problem? And they're like, no, who can do that?
I don't know, though. You'd be surprised because I know some older men, and they have told me that they go in for their regular visit, and in just their regular annual exam, their regular family practice internal medicine doc offers them Viagra just because of their age. Yeah. And I was like, how can it be that for men it's so easy? Plus they can order it online. Right. It's super easy for them to get any kind of erectile dysfunction medication, and for people to talk about it. But can a woman get her fingers on hormone therapy or estrogen cream to save her life. It's crazy. Yeah.
Yeah.
I just saw something. Was it yesterday or the day before? It said something about women can't get hormone tested or treatment most of the time because their insurance isn't even going to cover it. And then it sometimes is too costly to try to do it on your own. I mean, that just sounds crazy. Where are we? And what day and age is this?
Yeah.
Well, there is a background to that, and the reason that it's so hard for women to get care around their menopausal and perimenopausal symptoms is because most doctors are simply not trained in perimenopause. They just don't have that as part of their medical curriculum, education in medical school. And because of what happened with the very poorly run and poorly interpreted study back in 2001, basically anybody who graduated after that time, which is now all the people who are in practice, right, didn't get menopausal education about how to diagnose, treat, and mostly like listen, right? To like listen and not gaslight. And I would also say that sometimes people aren't very good at saying, I don't know about that, right? Women come in and they go, I have this, and I don't feel like myself. Maybe you should say, I don't know about that. And there is a specialist who can, help you with those kinds of things. But that's why. And it's across the country. And it's like a very, very common thing that women feel gaslit. They go in and they, so then like sex is down at the bottom of the list of how people are not feeling good. And that's why I was like, let's talk about it, because it rarely will get actually talked about in a clinical setting. And it's very widespread that women have sexual dysfunction in the midlife. It's a very, very common thing. And it's hard to get treatment. So yeah, let's talk about it.
Yeah, let's talk about what you just said. Let's start with that. You said women's sexual dysfunction. Tell us a little bit about that and what your thoughts are.
Well, so sexual dysfunction comes in sort of has like a couple of different categories to it, right? Because we know also that so much of sex happens up in the brain. And that's not only like, are we in the mood, but it's also, can we relax enough, right?
Right.
And we can talk about sex, like if you add a partner in there, then that complicates things because then you have the relationship on top of that. But even if we're just talking about sex by ourselves, sex for one, right? Our friend Betty Dodson back in the day, then we can sort of look at like, where is the dysfunction? Are we interested, right? Do we have any interest? So that's like up here, but those are neurotransmitters. Are we interested? Then can we respond? Right? If so say you don't necessarily have a lot of interest, but then you start to engage in some kind of activity, and then you go, oh yeah, that's okay. Oh yeah, I like that. Okay, good.
Oh, I remember.
Yeah, right. But sometimes you just get out of the habit, right? So there's like the interest to begin with, but then there's the response piece, and that a lot of it is in neurotransmitter land upstairs, right? But then we have exactly what is going on in the genitalia itself, right? And so dysfunction can happen around pelvic floor tightness, right? An ability to relax the pelvic floor. That may occur prior to perimenopause. But then once we start to have the loss of estrogen, progesterone, testosterone, we start to have loss of blood flow into the pelvic organs. So if we have less blood flow, we have less sensation, we have less response. And part of orgasm and arousal is erection of the tissue, right? So like the men get a very obvious, clear reaction of an erection, but the clitoris is actually equally erectile tissue. And that erectile tissue depends on blood flow, right? It depends on blood flow. And then for us to get up and over that orgasm, that depends on sensation and innervation, right? And so if we think about estrogen as like the hormone that keeps everything nice and soft and juicy, right? And then when we lose it, everything kind of goes, including the skin everywhere, including the tissue, including the tissue up inside the vagina. And then that in and of itself creates loss of sensation. And then we also have the skin gets thinner. And so when the skin is very thin, and then when we lose the moisture, then the friction that used to be great feels like sandpaper. And so literally I have women come to me and they're like, it feels like needles and sandpaper. It just hurts so much. And it's very, very common. And for some women that starts in perimenopause, like years before the actual menopause happens. We can have dry vagina. Dry vagina can feel like you can feel it walking around, like not even with sexual activity, but just like it hurts to sit, the toilet paper is too uncomfortable, that kind of thing. You can end up with you have a change in the microbiome, right? So the microbiome is that all those lovely living organisms that keep us healthy inside of our gut, but also inside the vagina. So when the microbiome loses estrogen, a little bit of it kind of dies. And so you can have the bad bacteria can come in, you can end up with BV and disorder in sort of the bacteria. All those things go together with the loss of estrogen.
Right. Now, I've thought, and correct me if I'm wrong, but I've always thought that was a myth that sex was uncomfortable. I'm not to that point yet, but I'm terrified what it will be like. But I thought it was just a myth that it can be uncomfortable, but it's really not as bad as what people say. Or it's just everybody's body is different, obviously. So that can make a difference there too. But I thought that was always a myth that sex could be painful.
It is. It's absolutely not a myth. It's absolutely true that, and even prior to perimenopause, right? Prior to perimenopause, 40-something% of women actually have some kind of sexual dysfunction. So painful sex is actually quite common in the population.
Oh, wow.
Whenever they report the numbers of these things, you always have to think that it's a little underreported, because how many people actually, they're doing a survey, right?
Like how many people are they actually reaching?
Yeah. And how many people are actually telling the truth about sex when someone asks them something, in a survey setting, right?
Yeah. Right. Yeah. Well, Anastasia was asking, what age does this tend to happen?
So the thing that's crazy about perimenopause and menopause is that inevitably, if we are lucky to live long enough, we all will go through it, right? 100% of women will experience perimenopause and menopause if they live long enough. And, God willing, we live long enough. It can begin in the mid-30s. It begin as early as mid-30s, and it can go all the way through. And perimenopause is the beginning. So it's the beginning of the changes when the hormones start to go crazy into like a storm cycle. And that perimenopause time can last 2 years for some people, 14 years for other people. And no way of knowing who which of those you're getting, like none of us would say, I'd like 14 years of insane hormone fluctuations, right?
No, thank you.
We don't get to say.
I think Anastasia was also asking during the time that you were talking about the painful sex, about pain in the vagina. I think she was asking like when that could possibly start happening. Do you have an idea?
That's a great question. And it really varies. So I have some women who are perimenopause and they're still going gangbusters, completely fine. They don't have any issues with dry vagina. I have others who are literally mid 40s or even early 40s who already are having signs of dry vagina. And it might
She's
start.
Like, not dry vagina. I'm just getting perimenopause.
I mean, no, not me. It might start with just like a little less lubrication during sexual activity, right? It might start with just like a little soreness afterwards that you didn't used to have, right? It might start with like a little extra BV kind of weird vag infection, not entirely clear, not an STI, but just like something funky. So it might start like that, like very gradual and something little. And then maybe you use more lube and you're good to go, right? But what's happening in the background is that as you lose estrogen, that tissue is losing estrogen, and we have estrogen receptors throughout the body. And so that I saw the next question was like, how do we avoid it? Well, we avoid it by, sort of paying attention to it, right? What are the signs to look for? So one of the cool things I think about women is that we are really expert in our own bodies. You know what I mean? Like literally every single woman I talk to, one of the first things I say is like, look, I might know more about like what the research says and the physiology of all this stuff, but I don't know more about your body than you know about your body. And so being in tune with how your vagina and vulva are feeling is number one, right? Yeah. Being in tune with how you're feeling before, during, and after sexual activity, right? Those are kind of your number one ways to like have a sense of what's going on. And then if you are also, and it's easy to find like the list of perimenopause symptoms. If you just Google perimenopause symptoms, there's 60 of them. Okay. So if you're in that age range of, basically if you're in your 40s and you're starting to have some funky vag symptoms, and then go ahead and look at your list and you're like, check, 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 because the list is extensive, but every one of us gets our own little curated selection from the list, which is also so crazy, right? Not everybody gets everything, and not everybody, like some people get lots of symptoms and some people just get very few. And the onset of those and how severe they are also very individual, depending on what our life experience is, how much stress we've been through in our lives, how much current stress we're under. There's a big impact on how we feel. Yeah.
Now, Misty was also asking, what exactly is perimenopause? Can you do a brief explanation of what that means? And then Mickey has a question. We'll go to that next.
Okay. Yeah. So perimenopause is the beginning of the hormonal shift that is heading us towards menopause. And menopause itself, like that word, it's the definition of it literally is just that you've gone for 1 year with no period. So it's really kind of it's not even really that important because we're all going there at some point, but it's the perimenopause that is so confusing for people and can make you feel like you are losing your mind. And like you must be really, really sick and something terribly wrong is happening, right, in your body. And it's also a time when we often are thinking about what's my family history, right? My dad has diabetes. My mother had, high blood pressure. My grandmother, like we start to think about all these things. And perimenopause, what's actually happening with the physiology is that it used to be that our hormones, estrogen, progesterone, testosterone, right? We also have like melatonin and some other hormones in the background, thyroid, but they used to go boom, 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 boom every month, right? You get you ovulate, you get your period, you ovulate, you get your period. And during that time, estrogen, progesterone had a pretty predictable up and down rhythm. And then at the beginning of the month, they go like this. And then in the middle of the month, they switch and they go like this. And we get used to that, right? As women, we're like, okay, get into some kind of a rhythm. You get used to kind of suffering some of the time. Like you get used to like, I'm going to, go to work and take care of my kids and do whatever, even though I feel like crap and, I'm bleeding like through all these pads and tampons and wish I could just stay in bed all day. So we kind of become accustomed to pushing through when we don't feel great, right? And like kind of hiding it, right? Like nobody knows. And that doesn't really serve us, honestly, right? Because then what ends up happening in perimenopause is that you start to feel poorly more frequently. And a lot of times sleep gets really messed up. That's one of the things. So before the period changes in perimenopause, you already have been in that downward spiral of estrogen, progesterone, testosterone for a couple of years, right? So a lot of women get gaslit because they're like, oh no, and I always say that like the first step of perimenopause is denial, because they're like, I'm not in perimenopause. And I'm like, oh really? Here's the list, you know, what do you think? Sleep disturbances are a big one. Mood, increased anxiety, decreased resilience to stress is a big one, right? So if you think about, you know, our lives, right? We have stressful lives. People are working, sometimes they're working more than one job. They're juggling children, sometimes all this other stuff, parents, right? Our lives are stressful. It's not like all of a sudden, just because we turned a certain age, that our lives have become more stressful. But when we have lost our resilience to stress, it feels more stressful. And we feel like, I just can't handle this anymore, right?
Yeah.
Yeah.
Did you know?
That's perimenopause.
I had never heard of perimenopause in my life until this show, until I started talking about how, because I was going through menopause right before I started this show. I had menopause during COVID. So it wasn't until I started going through menopause that I was like, what the actual fuck is happening?
Right.
Where am I supposed to turn to? I asked all my doctors, nobody knew shit.
Right.
And I was like, okay, I'm going to get to the bottom of this, but I don't want Misty to feel bad that she's asking as a woman, what is perimenopause? Are you fucking kidding me?
Yeah.
That we as women don't know. And we did a show about a year and a half ago called What Our Mothers Never Told Us About Menopause. And I don't know why, through the history of womankind, can't we not talk about what we're going through in our bodies and why we have to feel ashamed for it and why we got to be gaslit for it? It's unfathomable to me.
I know. I feel you. I'm so right there. And look, I already was a healthcare provider for women, and I didn't know that what was actually happening because I was too busy to like analyze and critically think about myself. I was too busy handling all the things. And then I couldn't find, even with all the people that I know, I couldn't find anyone who could actually help me feel better. So that's why I just was like, all right, I'm just going to order the clinician's guidebook and read it cover to cover. And so, you know, what I find is that a lot of my clients, they come to me and they're like, look, I've already done my research. And it's like, I appreciate that that's what we do as women, is like, we're going to figure it out. Right. But it also makes me go, really? Does this woman who like has her own regular career and family that she's trying to like manage and handle and stay on top of, really, do we have to give her the homework to get like her PhD in menopause to just be able to get good care? It's like crazy. It's really crazy. Yeah.
So for those women who are going through menopause and struggling with, I don't even want to use the word struggling, but just
struggle.
Yeah, they're experiencing a change in their sex life, and if they're married or they have a consistent sexual partner, what suggestions do you have to share with their partner? This is what I'm going through. It may not be as good as it used to be, but you know, like what types of, how would you see that conversation going? Because I can imagine it's uncomfortable, and I'm sure men probably get frustrated by that.
I love this question, Jada, because it's really one of the things that if you're in a relationship, it's really important that the partner understands at least a little bit, you know, of like what's going on.
I want you to finish that sentence, but I want to interject because Jada, that just reminded me, and I want to say to you, Sarah, that when you are my age, I'm in my 50s, and in my 40s and 50s, when I was going through dating apps and restarted dating, I ran into so many men who divorced their wives because they weren't having sex and their wives weren't interested in sex anymore. And instead of finding out what the actual hell was going on, they just abandoned their wives because they're not discussing it. Women don't know either. And so this continues. So I think the question that Jada asked is super important. So sorry, go ahead.
No, I mean, that is such a good point. And one of the things that we know about the data around people who cheat and things that lead to divorce is that for men, and supposedly, right, this is from the Kinsey Institute, and I always take any data with a grain of salt, but like for men, supposedly they cheat and leave relationships because of a lack of sex, whereas for women, women cheat and leave relationships because of a lack of satisfaction. And so you can imagine that as the woman starts to go through these hormonal fluctuations, where one of the big things that happens when you have these hormonal fluctuations is that your patience and your tolerance for things that previously you could feel was no big deal, really you just don't have the patience for it anymore. And in a partnered relationship, especially if you're living together, like just there's like, imagine the possibilities of what is really annoying that you had previously learned to, look the other way or step over, right? And then you just lose, you just like, you know what, this doesn't work for me. So it's also a really, I think, it's really like also rite of passage. So rite of passage is like when we change our identity from one thing to another, and you think about like before you were, when you were first a girl and then you went through puberty and you became a young woman, there's this, uncomfortable part of rite of passage that has to do with the hormones and the body changing and all of that. And then who am I now? Right. And then we spend like these, years of, teens and then 20s. We have this other transition of, who am I now? Right. And then we now often by the time we get to 40, we've like kind of got our act together. Right.
Getting there, yes.
We spend some time like figuring ourselves out, doing some healing, making good decisions, getting like fit and, eating well. And then all of a sudden the 40s come and it's like, I didn't change anything I was doing. All of a sudden, like I put on 5 pounds. What's this thing around my belly? Why do I hate everybody? How is everyone so stupid? And I just don't want to see anyone. Like, the feeling of like just not wanting to, like, there's an isolation piece that happens also in perimenopause of just like, I just don't want to deal with it. Like I'm good, And so there's a withdrawing that can happen, and that's just part of the hormonal experience. But if then you're dealing with a partnership, that withdrawing can really impact how the partner feels, and then add in whatever else is going on, all kinds of craziness is going on inside of a relationship as people are working through their whatever it is, childhood traumas or, ego shadow. And, so it's like sort of a ripe time for upset in a relationship, because also men and their sexual function is very much attached to their feelings of worth and their ability to provide. And so by their 40s, if their career hasn't gone the way that they would have hoped it would, if they don't feel like as successful as they thought they should be, then they're having like kind of a low self-esteem, and that makes it hard for them to show up and be attentive and compassionate. And then what the women are needing at that point is like even more attention and compassion, and like just compassion, right? Compassion. Like something crazy is happening in my body. I don't totally understand it, but like, what do I want at home? I'd like someone to just like be compassionate to me,
Exactly. There's a couple of things that I want to address. Mickey said, how would you know if it was just extra hard, intense session for sex, or is there something, or how do you know if there's something coming on? And I would think, because I've not gotten there yet, I think once in a while, maybe something like that, I could feel that. But it's like, isn't it like you were saying, like the thinning of the wall, the lining of your vaginal wall, that it's almost like a tear. So it's not the same as just sore, rough sex, correct?
It might feel like it might feel like that was a really intense session and maybe I should have used a little more lube, like it might feel like that to begin with. But then if it continues to feel like that, then, and you're in that ballpark window of age, then probably it's a loss of estrogen, which would be helped by, putting some estrogen back in that area. Yeah.
So with that being said, I have something I want to ask you about.
I think you're going to ask my question.
one of our readers, Matt, I know him through another group on Facebook. I love him. He said, spit on that thing.
I know who that girl is.
Which, yes, we've all done that, but it requires more than that, doesn't it?
Well, lubrication in the moment certainly is important, right? But if what you're dealing with is actual loss of the sort of vitality of all of that tissue, then even all the lubrication in the world is not going to make it comfortable. And so if you don't do something to kind of shift the dynamic of that just normal physiologic situation, then you're going to be down a path where the good news is that you can totally get it back. But I mean, then to kind of take it down even further, like I'm always thinking about the choices I make today for my health are determining how I'm going to feel 20 years from now. Right. Yeah. And so literally, like if you don't care for the vaginal tissue and the vulvar tissue, it can actually become very sclerotic and inelastic. And in addition to that, you can end up with issues around urinary problems. So you can have urinary incontinence because you think about it, right? The urethra is just right at the top and all of that tissue is going, all of that tissue surrounds the urethra. And if that tissue is then urethra is bigger and then it's easier for bacteria to get up in there. And so then you've got, so another symptom might be frequent UTIs. That's another sign that you have probably not quite enough estrogen in the mix, right? Frequent UTIs. And as we age, UTIs can become, if you've ever cared for elder family members, you know that UTIs can be actually very scary and deadly, actually. So this, like starting now when we're young and like what we mostly care about in the vaginal genital area is sex, right? But it actually has lifelong health benefits to keep all of that tissue healthy and the pelvic floor itself, right? So the pelvic floor is like a bundle of muscles that all come together and they're shaped like a bowl. And that pelvic floor, that's what holds up the bladder, the uterus, the bowels, the rectum, like everything, right? And so that tissue, so fascia, the fascia tissue, so if like you were to think about every organ, including our muscles, are covered with like a little protective plastic bag called fascia. And fascia has its own estrogen receptors. And when fascia is well estrogenized, then we don't have a lot of pain. We move around, everything can move well. When we start to lose estrogen, and you ask anybody who's in this sort of phase of life, do you have aches and pains, right? That's because your fascia is actually losing lubrication. So lubrication, so like we can think about lubrication in the entire body. And, my thing is, look, sex is such a good stress reliever. And if, and it's so
it really is
us, like for just joy and life in general, and be such a nice way to make a strong connection with the partner. And so, if you focus, like literally sexual health is cardiac health, right? It's psychological health, it's emotional health. So if we just it's fine. We could just focus on sexual health, right? Because if that's all good, all these other things are good too. Yeah.
Yeah. Are there any particular, you had mentioned, you talked about estrogen cream or just certain things that women can do. Are there any particular ones that you suggest, or do you suggest hormone replacement therapy, or what kind of is your go-to?
So understanding that the systemic use, so like menopausal hormone therapy using estrogen, progesterone, and testosterone, because testosterone is our other big one that's related to sex and sexual function and sexual response. So those 3 we can use in therapeutic doses for women, and we can start in perimenopause when they're ready. And that often will flip the estrogen situation with the tissues throughout the body. So including, right, where we would like to have things not so, so, right?
Yeah.
Trust
me. Back of my hands suck.
Yeah. So you could so if you're not ready for like a systemic menopause hormone therapy, then you can absolutely use just the local vaginal estrogen cream. And we use it by putting a little bit up inside the vagina and then another little bit all around the vulva, all around the clit, the vulva, and all the little nooks and crannies up into the G-spot. And that will, with regular use, right, that will re-estrogenize that tissue.
I have a question on that.
Yeah.
You said up inside the vagina. Now, will that change your pH balance to cause bacterial infections?
It will help to restore the pH balance.
Oh, because that's what I'm having problems with, is my pH balance is constantly going off. And it's like,
so
what the fuck?
When you put the estrogen back in there, that helps to create the healthier microbiome, right? And so, and then you also can use that estrogen cream on the back of your hands.
I'm buying this shit tomorrow. So here's the thing. When I was doing my research, I found this website called Parlor Games, and they give you a hormone testing. And they also have these creams called Silky Peach Cream. It's for bioidentical estriol cream designed for daily use. To help with pain, tearing, itching, scratchy. Then they also have like a progesterol. Did I say that wrong? Progesterol. It said Vibrant Third Progesterol. Bioidentical progesterone is the perfect complement to estrol. Vibrant Third supports your brain, bones, boobs, heart, digestion, and immune system. It's got rebounds cream. It's got chaos calmer. It's got all these things. And I'm wondering if you'd ever heard of it.
So I wouldn't first of all put anything in the vagina that has any kind of a scent or an added color, right?
Color. Okay.
Yeah. Because that's going to really mess with your pH. So nothing scented, nothing with added fragrance or color, right?
Okay.
And that also goes for like toilet paper, tampons, sprays, like all those things. None of those things are any good for the vaginal health. Into the vagina, estrogen, so estradiol or estriol cream is quite safe and certainly can be used widely, pretty much by anyone. They even give breast cancer survivors vaginal estrogen cream. Progesterone doesn't make sense to go up into the vagina. So progesterone, if we're going to use progesterone, we usually give it by mouth systemically, because the progesterone into the vagina is not going to get absorbed and do anything for your brain or your bones or your heart or your boobs or anything. So,
this is a cream that provides the right amount of progesterone to support healthy brain bones. So it's confusing that is there something that you or some type of place that you would suggest that we get that kind of support for what we're talking about?
Information I have actually a Substack that has a list of trustable resources for trustable menopause, like factual evidence-based menopause information. And you can just search Sarah Shealy Substack and it'll pop up, and it's like the first one. It's like resources for menopause education. And I add to that, I continue to add to it. So it's got books in there, it's got podcasts, it's got YouTube videos, it's got social media folks to follow who are doing evidence-based menopause care. In terms of having hormones tested, the evidence-based menopause care doesn't really require testing of hormones for getting started with menopause care. And the reason is that perimenopause it's a storm cycle, right? So it's like the estrogen progesterone are going crazy. If I go and try and take a test and my estrogen's up here and my progesterone's down here, then the test says one thing. But guess what? 2 days later, I take that same test. My estrogen now is down here. My progesterone is also it doesn't make any sense. So we really diagnose and treat perimenopause based on symptoms. And then we really treat until with the way that we do menopause hormone therapy is that we give therapy until your symptoms are resolved. And that's where we find the sweet spot because it's different for everybody.
What about someone like me who, how many years has it been since COVID? 4? 3.5?
3.5, yeah.
So 3? Okay, so it's been 3 years since I've went through menopause.
Yeah.
But I am having fucking memory problems and brain fog, and I'm scared to death that I'm about to lose my effing mother fucking mind.
Yeah, exactly. Yeah, it feels that way. It feels exactly like that.
Yeah, I'm scared. It's terrifying. It's
scary.
terrifying. So what?
See, and I'm going through menopause now, Christine. So where I'm at now, where you were 3 years ago, so it's it's been a year now, exactly 2 weeks ago. It's been a year that I've had no period. So I'm I think I'm done. Well, not done, but you know what I mean?
Yeah.
But I experience still brain fog, and I get so irritated by
my irritation,
smallest
brain
thing.
fog,
it's awful.
Sleep.
It's sleep, all of the
weight
things.
gain.
Oh, I forgot. Don't even get me started on that. But yeah.
That's what's depressing me the most is the weight gain. I can't seem to get rid of. I mean, lose the same fucking 25 pounds over and over and over and over and over. It's driving me crazy. So where can we go, Sarah? Did you say it was what? Your website?
So I have a lot of information on the Substack. So if you search Sarah Shealy Substack, it'll come up. And
so wait, SARAHSHELY, and then how do you spell Substack?
EALY.
Oh, EALY. Okay.
And then Substack, SUBSTACK.
Substack. Okay, so Substack, CK. I'm just putting that on there for them to for
the listeners.
Oh my God! See, this is my problem for listeners to see it scroll. I think that I don't know how we get the word out even further to help women understand and help men understand what their women are going through. Because understand, men, it's not just the woman going through it.
Yeah.
Men also go through their own hormonal changes, but if you're with a woman, married to a woman, dating a woman, please try to understand what that woman is going through. It'll help you understand what then in the end you're going through. You know what I mean?
Mm-hmm.
And also relationships die because of it too.
Yeah.
Well, and I was going to say, I think a final thought is just be compassionate and give someone grace. I mean, women do that for your man, but men do the same thing for your partner, your woman as well, because it's hard. It's frustrating. A lot of women go through severe depression because of the lack of resources and help. So I think it's just important to have that open communication, that open dialogue, and just be patient with one another.
100%. Yeah. And that's, all of those things are related to the hormone loss.
Yeah.
And all of those things can be reversed when you get some hormones back into the system at therapeutic levels. That the way that I've just opened this practice less than a year because I was so transformed by my own experience and how hard it was. So I decided I just needed to do this for women. And the amazing thing is to see women come back on their second and third visit with me, and they're like, I feel like myself again.
Yeah.
I can function at work.
I need this bad.
Want to have sex with my husband. You know, like, yeah, it's
Great.
powerful stuff. And
I love that.
my thing is like, we have worked so hard to get to where we are, whatever it is that we're up to in life, right? That we can't just like stop now. Like the world needs us, you know?
Right. Especially in our wiser, more advanced, you know, emotionally
stable.
That's exactly. Right. Well, Sarah, thank you so much for coming and being with us today. You are a fountain of knowledge.
We can do it too. Let's just, you know what, because I think you have such a great thing set up here. And I'm so impressed that you go live every week. I just think that's incredible and so impressive. And just like kudos to you both.
Thank you.
And I listened to so many of your podcast episodes getting ready to come on today, and just like,
I love it.
Hilarious. Like I'm doing my little walk and I've got you in my ear and I'm laughing out loud. So keep up the good work. And you know, anytime you need someone to fill in for a week, just call me and we'll set it up and we'll talk menopause again, whatever.
We've got to have you back. Absolutely.
Well, we are definitely having you back. Do you also talk about men's hormonal stuff or just women?
It's not my expertise to talk about men's hormone health. So I don't, but I can certainly find you someone if that was
would be great.
That was of interest.
Yeah.
But I also heard you once talking about orgasmic meditation.
Yes.
So I feel like there's a lot more to talk about, and I would love to.
We'll have you back. Why don't we do that next month? We'll have you back. Okay.
Okay. I got to take a picture of all of us. Right. Ready?
Oh. Yeah.
Okay. All right.
All right. Well, I hope I was smiling. I always get the worst pictures. Thank you, everyone, for coming and joining us today. Jada and I love having you all here. And Sarah, we will be having you back. And next week, same time, same place. And until then, hang on a second, Sarah, and we'll talk to you after the show. And until then, keep this shit real.
If you enjoyed this episode, please share with your friends, like and follow us on Instagram at 50 Shades of _bullshit and Facebook at 50 Shades of Bullshit. Thanks so much for listening, and we really hope to see you again next week.